So let's talk about curriculum development, and I'm going to show you two different models, sort of a quick and dirty model, and then a more elaborate and I think interesting model that takes a little more time. So this section is useful if you need to create a new training program or even just a single session. It's also useful if you want to revise or improve an existing curriculum, or maybe if you just want to understand how these kinds of things are pieced together. The two models that we're going to be using, the first one is called GNOME, G-N-O-M-E, and the other one is a sort of more classic 6, and I expanded it to 7-stage curriculum model developed by David Kern, mostly in a medical school setting, but we're using it in the School of Nursing and School of Social Work as well. Okay, so the first one up is GNOME, and GNOME simply stands for Goals, Needs, Objectives, Methods, and Evaluation. So it breaks this process down into multiple steps. So the goal is, what are you trying to accomplish? What is the problem that you're trying to solve? Your needs, what do your learners or patients need? So that requires, I think, doing a little bit of exploration of better understanding where are my learners starting. That's partly developmental level, but it's also partly getting a sense of what is it that is already known and what is it that isn't known. I will say that over the years, and so I've been teaching for 25 years or so, our learners, our first-year students, have arrived with very different skill sets, and I find that really fascinating. So when we were in the 90s teaching about what is culture and what is cultural competence, and we were doing that then, our learners were arriving, and many of them were saying, well, I don't think I have a culture. Obviously something that's not true, and I think a belief that's not held so commonly now. Now we have learners that are arriving that are much more sophisticated in their understanding of sociology, psychology. It's a requirement now to get into medical school. They've thought about health disparities, health equities. They've thought about social justice and activism. So they're starting at a much higher level, so their needs are different. The needs then became a challenge for some of our faculty who felt like the learners were arriving knowing more than the faculty. So we had to raise all boats by doing training for everybody. So the O part is the objectives, and here we want to specify what will be learned. And it can be course objectives, it can be session objectives, and I think the more concrete and specific you can get, the easier it is to do your assessments later, and the easier it is for your learners to know exactly what you want or expect from them. The methods, so this is where we talk about pedagogical techniques. So how will it be taught? Is it going to be a Zoom class? Is it going to be field trips? Is it going to be a book club that you'll be using? Lots and lots of different choices we'll get to later. And then the E, evaluation, is how will it be assessed? This is the Kern model. It's typically a 6-step model, and I couldn't resist just adding on a 7th step, because when you read through the Kern model, it gives you the sense of, okay, once you've been around this wheel once, you've been through those 6 stages, you're done. And I think most experienced teachers know that's not the case, or hopefully is not the case, that your curriculum is always growing, is always improving, is always changing based on the changing needs of your learners or the changing climate or what's happening out in the world. So we have, just to give you an example, we've pivoted this year, and when we're teaching about prevention of infectious disease, or we're teaching about medical ethics, we're bringing in a lot of COVID examples because it's so present and it's so immediate, and it's so important for our learners to be able to see why this particular information matters. In the realm of substance use, we're doing a lot more around opioids and around overdose prevention and different sort of health systems changes that might help patients, might prevent opioid use disorders, or might help those patients who have developed them receive treatment. So if we look at the steps of the model, you can see it's similar to GNOME. Here is problem identification and general needs assessment refers not just to the learners, but to the problem or the issue in society that you are trying to solve. So is it the prevention of overdose of opiates? Is it the prevention of transmission of HIV, for instance? So what's the problem And in my context, I'm in a healthcare setting, so it's usually sort of a health need that we're thinking about. The targeted needs assessment is more about the learner, and you might even use a survey, an interview, or a focus group to get an idea of what folks need. Again, your goals and objectives. Goals are bigger and broader. Objectives are more specific. Your educational strategies. This model, unlike GNOME, puts in an implementation step. And here you can sort of put your change management hat on and think about how am I going to get buy-in from my other faculty, from my other supervisors, from the leadership when I tell them I need an extra 4 hours to teach this information, or I need a certain set of resources, or I need to advertise my course on your website, for instance. So all of those pieces are important if you're going to be able to promote uptake of the educational intervention. Evaluation and feedback, that was also part of GNOME. And then I mentioned that 7th step of curriculum maintenance and enhancement. And I hope that feels exciting and inspirational and not discouraging that you're never quite done. But it means that there's always room to grow and to improve and to be creative.